DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Folks, thanks for joining us today. We're going to have a great show. We have Dr. John Hutcheson joining us. We're going to talk about getting cows bred. We're going to talk about calving season, implants, parasite control, and so much more. It's going to be a great show, so stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodiris, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson here with Dr. John Hutcheson. And Dr. Hutcheson we have known each other for a long time and worked together, and he is a ruminant nutritionist. He has spent so much time in the beef industry, research, probably one of the more published people I work with in beef cattle growth, physiology, production, management, parasitology. He's the director of beef cattle technical services at Merck Animal Health. And welcome to the show.
You bet. Thanks, Dan. I enjoy being on the show. It's a great thing and a great service you provide to all the cattle producers out there.
Well, thank you. And we are in Aggie land.
We are in Aggie land.
And you are a former student.
Yes, sir.
Texas A&M University. And it's been a great trip.
Yeah, you've had a lot of people you visited with, from Dr. Mathis, Dr. Herring, right? Dr. Washburn, Dr. Beck, Dr. Sable.
I know.
You got in the dean's office, right?
Yeah,
exactly.
I used to get in the dean's office when I was in academia, but it wasn't for the same reasons as today. But
well, I'm glad you're here at Aggie land. So the Aggies, I can count on them. They showed what's going on here and all the good stuff that's going on here.
It was fantastic.
Awesome.
So, let's talk about getting cows bred.
Yes, sir.
And there's technology. There's obviously many different things, bull power, but just kind of some of the basics.
Yeah, I think some of the basics are, we give talks around. Our tech service team does, and we talk to cattle producers. And we just remind them of, checking all the boxes to get things in order for breeding season or what that may be. And so the first thing I always tell everybody is, if you've got a veterinarian, you should get a veterinarian involved in your herd health plan. And that goes to getting cows bred, because, getting bulls tested, right? Yep. BSE, breeder soundness exams, we want to get done. We want to get it done every year. We don't want to just assume they're okay. We want to look for injuries. We want to get those kind of things organized. Yep. And then, of course, about getting cows bred is also the cows part of it is the condition. And so with the drought that's kind of persistent around the southern part of the United States, people need to be honest with their condition scoring and what they need to have. I mean, they need to see those cows, when they're ready to get bred, in a body condition score of 5 or greater to be able to get pregnant. Yep. And so that's the biggest thing. I would say most ranchers, their limiting nutrient for their cow herd is energy. And so look at their pasture, look at their condition on their cows, test your bulls, understand bull power. Some bulls, aren't breeding as many cows as I think people think. I think people overreact to the price of bulls and how many bulls they should have per, to breed a cow. And so, work with your veterinarian, understand your bull power, but, think younger bulls are probably less than 20 cows. You get older bulls, maybe that break point's 2 years of age or 2.5 years of age, and older, they can get 30 cows bred on average. And so those are much different than sometimes I see. And again, condition of the cows is critical, which
Yeah.
is all related to energy and forage quality and forage availability.
Yeah, and I think that, not just, you've got to plan ahead, because that body condition score is, 7% of the body weight is what we would consider. So if you have 1,000-pound cow, it's 70 pounds equals a body condition. And so that's what you have to think about putting them on,
That's
putting
right.
on or.
Yeah. And the bulls, I mean, have a backup plan if one gets injured.
Yeah,
You know,
absolutely.
I mean, there's a lot of things that go on both bull and cow to get them bred.
Yep, perfect. We're going to take a break. When we come back, we're going to talk more about calving season with Dr. John Hutcheson. You're watching DocTalk. We're glad you joined us.
We're very focused on experiential learning, where people can not only learn in the classroom of the concepts, but they can put their hands on animals, that they can glue those concepts together with things that they touch and feel.
The Department of Animal Science is a world of opportunity for anybody to be successful.
Hey folks, Dr. Dan here, and welcome to the Cattle Intel by Neogen. We're going to talk about down cows. And there's multiple reasons why an animal or cattle can go down. And it can be infectious disease such as listeria or histophilus. It can be a toxin like sulfur. It can be like polioencephalomalacia. It can be due to trauma from slipping or hitting their head and different things like that. And so getting a proper diagnosis of why the animal is down is important to the treatment. Generally speaking, when an animal is down, veterinarians have a broad spectrum treatment because we don't know exactly why the animal is down at this time. So it includes an antibiotic, a steroid, and usually some B vitamins. But make sure that the animal is comfortable. Roll the animal over every 6 hours to prevent compartmentalization. And then make sure that if the animal's not responding, to humanely euthanize that animal within 36 to 48 hours. This has been your Cattle Intel from Neogen.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with Dr. John Hutcheson. He is the Director of Beef Cattle Technical Services for Merck Animal Health, also a former student of Texas A&M, and we're here at Texas A&M in College Station with Dr. Hutcheson, with the Texas A&M faculty. It's been a great trip. And John, we're talking about kind of the things we can do to increase profitability in our calf crop and on our ranch. And one of those that you've talked about is calving season, right?
Yeah, no, that's right. Calving season, having a shorter calving season. Some of that data is driven by, we get the access to Superior Livestock auction data, the video sale. And one of the things we see that gets discounted, not a premium, if you want to look at it both ways, I guess, but a discount is when calf herds or calf crops are very uneven, right?
Sure.
So there's big spread in weight variation, and people are trying to put their calves together to sale, and they see that big variation. Well, that's due to, I would say, mostly due to improper, planning for the breeding season. Can I shorten that breeding season up? How do I get more of those cows bred in that first cycle, right? So, turn the bulls in. How do I get most of them bred? There's a lot of different things, but when you look at the data that we see from a Superior Livestock, there's a simple discount of those calves that have a lot of variation.
Sure.
And so that's one thing. But the other thing is, you give up weaning weight, you give up lifetime performance. If they start behind, they kind of stay behind when they're steers. Those that were born early in the weaning season, they're going to have heavier carcasses. They're likely going to have better quality grade. Those carcass attributes that are, you might not be thinking about as a cowman, but you ought to be.
Yep.
And so those are some of the things. The heifers that are born late, they're probably not going to be the ones that might not be fertile when they need to be come into the herd, and they might not get bred early.
Yeah.
And so you have some reproductive issues that may come up with those calves that are not born early in the breeding season. So just important for a lot of different things.
Yeah, and we talked about it too. We do branding, at 90 days or 120 days, and if you have calves that are spread out, and you're going to have some of them that were born in that first month versus some of them that were born a couple weeks before branding, and the vaccine efficacy isn't the same in those ones that
Sure.
that are born later.
Yep, because you got colostrum going on, maternal antibodies interfering, and then some products that are labeled for different ages of calves. A lot of products are greater than 2 months of age or greater than 3 months of age, and so as you get those calves that are younger than that, you have some issues there.
And so you see the performance, but you also see the health difference in those feedlot guys. They feed things that are either, they bought them uneven, they bought them even, and they figure out pretty quick which ones are going to be health or performance challenges.
That's right. Yeah. Because, they won't try to produce, their goal at the end of the feeding period is produce a truckload of beef, right? They're standing on the hoof, but they're loaded on the truck, but they want them as less variable as they can, right? So they can get them to those heavier weights and not have so many off to the end, right? The end of the distribution.
Yep. And we've got 30 seconds, but some of the work that y'all have done on synchronizing with natural coverage with bulls has really helped bring more of those cattle into that first.
I think you talked to Dr. Poehler here at A&M about it a little bit, and so there's ability to have natural synchronization or put natural service with sync program with some simple strategies like prostaglandin at a certain time after you turn your bulls out, for instance.
Makes a huge difference in the profitability of your ranch.
Yeah.
So let's take a break. When we come back, we're going to talk about implants in the ranch situation. You're watching DocTalk, and we're glad you joined us.
In a world where every business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. John Hutcheson. And Dr. Hutcheson is a ruminant nutritionist. Did his training at Texas A&M and Colorado State, and tremendous asset to our industry. Does so many things for so many of us. We see the publications, we see the work he does as the director of Beef Cattle Tech Services, but I don't think anybody supports our animal science programs in the United States on the beef cattle side more than what you do, John. And I'm just very thankful for you seeing the importance of all the things going on with these grad students.
You bet. Thank you. Well, undergrads and grad students. If as agriculture, we always use that. It's shrinking the number of people that are providing food to the world, right? That population of people that are doing that keeps shrinking. And so I had somebody tell me one time, the earlier you can get your hooks into people and make an influence that, you can influence that trajectory of maybe their career or what they want to do. And so I get to hang out with a lot of animal science departments, and obviously my heart's at A&M.
Yep.
And so, I enjoy the opportunity to interact with them and provide them opportunities to see there's just a lot of good stuff that goes on in agriculture that kids from a wide variety of backgrounds can get involved with. And so if I can be just a little bit a part of that to encourage them to stay in agriculture, I think that's just good to do.
Well,
So thank you.
You've done good. So thank you. Let's talk about implants and calves and,
You bet.
and the calf
you bet.
crop.
And the calf crop.
Yeah.
And so, it's one of the best ways to increase revenue on a cow operation. It drives me crazy sometime to see people not taking advantage of that. And when I say what that is, it's those implants have been approved since 1969.
Yep.
That are used, and there's a couple of them that can be used in calves. Ralgro's one of them. Synovex C's another one. They're labeled for calves. They're low dose. And with the Ralgro, I'm more familiar with that data set. It's 23 to 25 pounds of weaning weight. So if you give them to them when they're 2 months of age or older, and, depending on weaning time, but as long as weaning time's greater than, say, 60 days later, probably even greater than 30 days later, it's still going to work and give you some pounds. And so you think about 25 pounds for easy math, and a 550 weight calf bringing $4 for easy, 5 weight calf bringing $4. That's an enormous amount of revenue on
$100.
$100 in today's market, $100 per calf. And so easiest way to increase revenue, and those things cost $2.
Right.
And so
that's a 50 to 1 return on investment.
Yeah. And it's so easy, no matter which one it is. Little needles, little implants, put them in under the skin of the ear and keep things clean, and, be a little bit cognizant of, that the ears are clean, and it's 25 pounds.
Yep. And we don't implant bulls.
Don't implant bulls.
Ever.
There's some considerations when it comes to heifers. They're approved for implanting replacement heifers, but you want to check with your veterinarian and kind of understand what you're doing. If you're raising replacement heifers, you may choose not to, or you may know which replacement heifers you're going to keep, and the other heifers you should implant. Again, they're approved, but you just need to have some thoughtfulness go through your decision making.
But definitely the steers.
Definitely the steers.
That's absolutely fact. All right, we're going to take a break. When we come back, we'll wrap up with parasite control in the cow herd with Dr. John Hutcheson.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrosyn by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrosyn.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosyn.
I'm PJ Trowbridge. Me and my dad run Trowbridge Farms here in Ghent, New York, and we're using the Alertis on-farm pregnancy test.
The Alertis on-farm pregnancy test for us has been unbelievable time saver, especially on a beef farm. Don't have them in every day, so when that group of cows comes in, we can do it right then and there.
It is a very simple test to use. We have an internship program that we can teach the students within a matter of minutes how to use it. You can do 1 cow or 10 cows. It's really simple to use.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson with Dr. John Hutcheson, and we are wrapping up a great couple of days at Texas A&M University. And been very, very humbled to have the hospitality of the folks at Texas A&M and Dr. Hutcheson and his wife, Georgina. Just a fantastic trip, and thanks for all you do.
You bet. Thanks for coming down. I think everybody enjoyed you and the DocTalk show on the road. So Of course, this is the first time you've come to A&M for DocTalk, so we got to make this an annual event.
There we go.
We just got to write that. Now it's on TV. So annual event, it has to be.
I've learned how to.
Yes,
there you go. Gig 'em. So, but thank you. Dr. Hutcheson is the Director of Technical Services, Beef Cattle Technical Services at Merck, and a former student of Texas A&M, if you couldn't tell. He's only got 3 or 4 stickers on his pickup, but it's fantastic. What a tradition. And let's talk about parasites. We've talked about bulls and getting cows bred, and then when they get bred, let's get them an early calving season. Then when we've done that and taken care of that, an advantage, we've implanted them, but we got one more step, and that's talking about parasites.
One more step to make more, increase revenue.
Yeah,
right?
I mean, we've already added up.
Get cows bred, right? That's number one. That's critical.
Yep.
So test your forages, test your feeds, understand body condition, understand how many bulls you got out there, have a backup plan. Right? I mean, just those kind of things, getting them all bred early in the calving season is gravy. They'll weigh more, they'll have better lifetime performance. Implants 25 pounds, $4 a pound, $100.
Yep.
Gross margin. I mean, and here we are, parasites. They are everywhere, right? They are in the pastures. They're in our pastures. They never go away. We have to deal with them. And so we've been doing a lot of work on parasites, particularly surveillance. So we've been doing surveillance studies in cow-calf herds in Florida, Kentucky, Missouri, Oklahoma, and Texas was an initial couple of years ago. We wanted to go out and just see what producers are doing. But back to diagnostics, we wanted to see how efficacy was in the programs that they're using. So we didn't ask them to change anything. We just asked them to do what they normally did. And we pulled fecal samples at the time of working when they dewormed. And we pulled fecal samples at the 14 days later after that working, and to kind of test that efficacy of those dewormers. And I'm telling people, if you're not doing that now, it's crazy for people to let that not be tested. What we found out was across ranches, there is an enormous variation in efficacy in a bad way. And so, a lot of the products that we pour on and that we inject, those macrocyclic lactones, they are not demonstrating greater than 90% efficacy. They're more like 60 to 70% efficacy. And so, but the only way to find that out is to test, because some of those ranches, the efficacy is fine. When you look at the benzimidazoles as a class, those dewormers, most of them were all over 90%. There's still some variation there too.
So that would be like Safeguard, drench.
Yep. And then the last was those that were actually using a combination deworming, which we recommend in feed yards and stocker operations and cow-calf operations as well. But when you put those two classes of dewormers together, macrocyclic lactone and a benzimidazole, what we saw was greater than 98% efficacy across all those ranches that were doing that. But that was a minority of the ranches.
But that would be an ivermectin, with a Safeguard. Do them in tandem.
That's right. Yeah. That's right. Get rid of those because they damage the gut. They reduce feed intake, grazing intake. They reduce immunity.
Yep.
They reduce production. I mean, there is nothing good about a parasite that's living in the gut of an animal.
Perfect. Get your cows tested. Work with your veterinarian. Know if your parasite control program is working. Worth lots and lots of dollars to you and the longevity of your cows. But thanks for being on the show, man.
You bet. Take care. Thank you.
Thank you. And thanks for watching DocTalk. If you want to see us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian, with Dr. John Hutcheson here in College Station, Texas at Texas A&M University. I'm Dr. Dan Thomson, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.